Often when a person maintains their overall health through diet, exercise, and proper sleep habits, the body is better able to compensate for a medical condition. However, for several years, the popular opinion was that people who suffered from arthritis should limit their actions to protect their joints from damage. But that belief has now been dispelled.
Moderate exercise can have a dramatic benefit for a patient with inflammatory arthritis. Patients who actually exercise even for a few minutes a day notice that there's a decrease in fatigue, their energy levels increase, and also one of the added benefits, they have a decrease in weight. All of those things that have a protective benefit for the soft tissue around the joints and giving patient even more benefit in addition to the pharmacologic therapies that we use for our patients.
For those suffering from more advanced stages of arthritis, regular exercise may not be an option, or it may be something that a person needs to build up to. However, there are still immediate steps that can be taken to help improve your condition.
Range of motion exercises are ones in which we ask the person to put the joint through a full range of motion. So for example, moving the shoulder about or moving the hip about. The reason we do this is because the tendons and ligaments around joints can become stiffened, and by doing such range of motion exercises, we keep the joint supple.
While exercise may help strengthen a person's system, rest is required to give it time to recover. And just like exercise, there are several different levels of rest.
While we do encourage people with arthritis to stay as active as possible and to exercise whenever possible, it's important to remember that rest can be an important part of the management of this condition. Good sleep at night is a critical element. When you're going to exercise, if you haven't been exercising before, start slowly, build up slowly, and take advantage of rest in between when necessary so that you don't overdo it. And sometimes resting individual joints may be helpful. So for example, a patient who has inflammation in a wrist might wear a splint on that wrist at night. That'll reduce the inflammation and improve their function and pain during the course of the day.
As the body begins to repair itself and to fight off these inflammatory cells, patients do require a significant amount of energy. And as a result of that, the body needs to repair. One of the things that we see in patients is that as the body repairs the muscles and joints around the inflamed tissue, that does take some energy. Patients do feel the fatigue. So getting a significant amount of rest is important for our patient with inflammatory arthritis.
In addition to exercise and rest, diet plays an important role in arthritis management, though indirectly.
It is very common for patients to be curious about diet, both in the context of the cause of arthritis and its treatment. This is partly because there's so much press about the relationship between diet and arthritis. However, when this is subjected to scientific scrutiny, it doesn't pan out. It really doesn't appear that much in the way of diet has any meaningful impact on arthritis. Now there's a few possible exceptions to this. For example, there's been some interesting research that supplementing omega-3 fatty acids in the diet will help inflammatory arthritis. But this is fairly minor, and in truth, what I tell patients is that they can eat what they want. Now, there are some other points, though, about nutrition that are important. For example, if you overeat and become overweight, that puts more strain on joints. On the other hand, if you are in a flare, very painful, depressed, and not eating a balanced diet, then this is also not good. So what we counsel is just have a good, balanced, regular diet.
At times, a physical or occupational therapist may be needed to instruct patients on the best methods for alleviating pain and protecting yourself from further injury.
I think a physical therapist is an invaluable member of the team for the arthritis patient. A patient can learn from them about body mechanics, strengthening, exercise, use of adaptive aids such as canes, use of orthotics. So this is a very important relationship for the patient with arthritis. The role of the occupational therapist is very important. They can teach a patient about preserving energy, protecting joints, doing tasks of daily living. They can also help with problems with the hands and wrists, make splints, and generally improve the patient's function.
While patients receive a wealth of information from their physician and caregivers, they often wish to learn even more about their condition on their own. For many, the primary destination is the homepage of the Arthritis Foundation, located at www.arthritis.org. At this site, patients can learn more about their symptoms, diagnosis, and pharmaceutical options. They can also get involved in local events and programs designed to raise community awareness and funds for research. There's even a special section showcasing consumer products that are user-friendly. And that's just the beginning of the valuable resources provided by this trusted organization. For those seeking online content specific to rheumatoid arthritis, we suggest you visit www.ra.com. At this site, you will find a wealth of information that includes educational articles and animations, diagnosis and treatment options, and an interactive drug guide. In addition, you will find helpful daily living tips and the latest news features related to advancements in understanding the disease.
Persons suffering from the chronic pain associated with arthritis often wish to speak with others who share and understand what they're going through. At the National Pain Foundation's website, located at www.nationalpainfoundation.org, there is a continuously growing online community where people come together in an open forum to discuss the specifics of their condition.
Some of the online forum information at the nationalpainfoundation.org include personal diaries, information about people's own personal experiences that they can share with each other. You can contact someone there and find out what they went through, what you're going through, compare that, see what they found as a solution to help improve the quality of their life, and utilize that for yourself. It's important for people to have validation for their pain because there's no way to prove or disprove that someone hurts. We have to be able to believe the person who says they're hurting because their own experience with pain is unique to them. It's controlled by many factors, including physical factors from the nervous system, cognitive factors from their brain, emotional factors, and cellular memory factors. And the degree to which of those influence somebody's pain is unique to each one of us.
And that brings us to the end of our program. On behalf of the staff at Health Explorer, we would like to thank you for taking the time to watch this presentation. We hope the information we provided has helped you gain a better understanding of rheumatoid arthritis, psoriatic arthritis, and ankylosing spondylitis. We'd like to remind you that every patient's case is different, and whether you are someone that has been newly diagnosed or whether you have lived with the condition for years, modern medicine is constantly striving to provide options to improve your quality of life. It is important that you work closely with your physician to tailor the best treatment plan for your unique situation. In the end, we hope that you reach a successful level of pain management so that you're able to live your life the way you want to, not the way your condition mandates. Thank you and good luck.